Hello. So, usual disclaimer, enjoy this. If you're having nail surgery, hopefully this will put your mind at ease. So we're starting off with the injection. It's a very quick injection. As you will see, this is real time. So essentially we're just popping it in. So we're going to numb the entire part of the toe here. So the skin area has all been prepped previously. Yeah, and we're pretty much done there now. There we go. So now we wait till it's nice and numb, and we're going to wrap this blue thing. Is called a tourniquet. This particular tourniquet is an Esmarch bandage. So I'm doing a wind down technique here. So I'm wrapping it around the toe. It's a bit of latex, and you kind of like pull it a little bit tight as you wind it down, and then I will clip it off. And what that's doing is squeezing the blood out of the toe and preventing fresh blood from getting into the toe. That means that taking the pieces of nail or the nail away is very clean. There's no blood, no mess, anything like that. So this lady's had an ingrowing toenail for quite some time. You'll notice that an area on the nail is kind of a dark browny blacky colour. That is from something called silver nitrate, which we'd used at a previous appointment because it was rather painful for her and she had a big lumpy bit of fleshy tissue. Now there's no blood in the toe. I'm going to slide down this little instrument here, and that's just separating the nail from the rest of the toe. I'm just taking the sides on this one. You can take whole nails, but wherever we can, we'll try and leave as much nail as possible. So it gives kind of a normal appearance when it's all healed up. So now I'm using, they're what we call thwaite snippers. So they're flat underneath and kind of cutty on the top side. So we slide that underneath the nail plate and then we just snip it. So all this is real time. So it really doesn't take long once it's numb. And we did check first, obviously. It really doesn't take long at all to do. So now I've snipped those bits out. Now I want to make sure that this is going on because the cells that make the nail live underneath that sort of bottom part of the nail, underneath the skin there. So I need to make sure that the pieces I take actually include those pieces, because if you leave bits of nail behind, then there's a greater chance that those pieces will regrow. So now I've made sure that section is staying. I'm using a pair of forceps and I'm just rotating that piece of nail out. So that's the piece from the problem side. It doesn't look very big, but like I say, we had a previous treatment where we did remove a decent chunk there. This is just the permanent side of the treatment. And again, I'm taking a sliver from the other side because it is very curved. And as you can see, there's quite a chunky piece has come out of there, far bigger than you really at first think will be down there. So again, I'm just trying to make sure that there's no little bits that have like kind of broken off or evaded me. Found a little piece there, and then what I'll do is, once I've finished there, now I'm going to use an instrument just to double check again that everything is clear. Well, first of all, I'm drying it out, get away any moisture, any sort of bits of blood that's been left behind. Like I say, the blood's been squeezed out of the toe by the tourniquet, which is why the toes are whiter, paler colour than the rest of the tissues and the rest of the toes, which have got a decent amount of blood going to them. So again, like I say, I'm just making sure that the edges there of the nail are nice and straight so that we end up with a good result and I've not left bits there. Now this is the chemical. It's a chemical called phenol, and this is what kills the cells that make the nail. So as you can see, we haven't done any cutting, any stitching, anything like that, because we actually use the chemical to do the work in killing those nail cells. So it's a very powerful chemical. It's self-limiting, so it'll only burn down so far, it is also a very, very good antiseptic. So it doesn't matter if there's local infection there, this will deal with most things like that. So what I'm doing there is I'm agitating it into the nail bed, and again trying to expose all the nails making cells from those side pieces that I've taken. Anything that's left there, I'm exposing to the chemical to kill those cells basically. Now this procedure is about 95% successful, so it's not a guarantee, as in life there's no guarantees, but it is pretty good odds. Now we actually time the length of time we have the chemical actively working. So we do 3 separate applications at 1 minute each. Some practitioners do a little bit that, you know, kind of play with it. They'll either do 3 solid minutes or 2 solid minutes or 2 single minutes. But we like 3 just to make sure, because we want to try and keep that chance of regrowth down to an absolute minimum. So now I'm wiping out that chemical because, like I say, I'm going to do 3 separate 1 minute applications. So I'm just soaking up any of that chemical into that piece of gauze there. I mean, the chemical, again, I'm just making sure that everything's clear there. The chemical changes the healing of the wound. So once it's done, so this again, the following 2 minutes sort of sped up, but the chemical changes the way that the wound will heal. So it becomes more of a chemical burn than a normal wound. So healing can be prolonged because of that. But ultimately, we teach you how to deal with it, and we're always here if you have any problems. So I've done the following applications there. So when they're all done, that's it, job done, really. So we don't want the toe to drop off, so we take the tourniquet off, and it's very simply done. And you'll see straight away really good return of the blood flow to the toe. That's always a reassuring sign. So initially it'll look quite red and quite angry, and then it'll start to normalise. Now, the majority of these nail surgeries don't actually bleed. Some do, especially when they have really big, you know, the big fleshy parts that overhang the toe, which we call hypergranulation tissue. That's jam-packed full of blood vessels. We try and kind of zap it with that phenol while we're doing killing the nail cells, but sometimes they do like to have a little bleed. This lady has a very small, slow sort of ooze to it, that bit of hypergranulation that was there. And so we're just going to apply a little bit of pressure to the area with a clean gauze pad. The other side, as you can see, there's no bleeding too at all. So slight bleeding is really no problem whatsoever. So we'll get that to stop with that bit of pressure, and then we'll apply a bandage to it. Now, like I say, the toe is nice and numb at the moment, and it'll stay that way for up to a couple of hours, depending on what anaesthetic is being used. But like you say, so at the beginning, we inject the base of the toe. So essentially, everything north of that of those injections, so for the whole toe, basically above those injection sites, is now numb. It's what we call a digital or a ring block. We create a numb toe, basically. Everything below those dots is still sensate, so you can still feel it just as you would normally. So after the numbness has worn off, they tend not to be that painful, actually. A couple of paracetamol if it's feeling a little bit throbby, but generally they are quite painless, and surprisingly so. Now we've got any of that bleeding under control. Oh, that dark area on the nail, like I say, that was caused by a previous treatment of silver nitrate, and it does stain. So as that nail grows up and out, the staining will come away with that. So that's certainly not a permanent feature. So this is kind of a bit of a non-stick gauze we use. There's no antiseptic in there because, like I say, that phenol chemical is very, very antiseptic and antimicrobial. So we don't need to use anything extra unless there's other reasons for it. So I've put a dry dressing on the top there and what we call some tube gauze to hold it all in place. And I'm going to pop another couple of pieces of sterile gauze between those layers of tube gauze. And what that does is, should it have a little bit of a bleed, it's just there to kind of pick up any extra. It also, the bulkier the dressing, the less likely you can get your winkle picker shoes on, which means you're going to be causing less trauma to that toe. So that dressing now will stay in situ until we see the lady again. And that's usually within that working week or sort of within a 5-day period. And you keep that dressing on and dry until we see you. Any bleeding, any problems like that, we ask to add to the dressing and not remove it. And obviously any problems, give us a shout. But these are the pieces of nail that I took. I've apologies for the coming out of shot there a little bit. So there's a piece of nail. So that was from the silver nitrated side, and that was the problematic side. So like I say, a lot shorter. Now the kind of whiter edge of those pieces of nail are where those baby nail cells are, so what we call the matrical cells. And again, it'll come into shot now, and they're very soft, very pliable. It's very, you know, baby nail. And then obviously as it grows up and out, it becomes harder and firmer and just like normal nail, like that. So that's that. So we'll be seeing this lady again in a few days, and then she'll be redressing the toe herself. We'll show her what to do and give her everything she needs. So I hope you found that interesting. It was very much a whistle stop tour. Please like and subscribe, as there's loads more videos coming up. So thank you very much. Bye.